in terms of research, you can think about doing a request for proposal or instituting a center for some sort of development that you're seeking. So yeah, just think outside of the box. You don't have to be constrained with any specific legislative solution. And yeah, in terms of that, just consider the costs and benefits of anything that you're proposing. Be mindful of who you're speaking with, what side of the aisle do they reside on, and what's important to them.
Welcome to the official podcast of the Journal of Science Policy and Governance. In this podcast, students and early career researchers share more about their publication in the journal. Join us weekly to hear from the next generation of STEM leaders as we elevate their voices in science, technology, and innovation policy. Welcome, and thank you for joining us today for this episode of SciPol SoundBites, a podcast of the Journal of Science Policy and Governance. I'm Adriana Bankston, JSPG's Chief Outreach Officer and your host for this podcast. Today, we celebrate the release of the joint issue between Journal of Science Policy and Governance and the National Science Policy Network, resulting from the 2020 Policy Memo Competition. We would like to congratulate the competition winners who will be featured in this episode, all of whom are graduate students. Gabrielle Delima is from Emory University, Kyla Mace from University of Pennsylvania, and Alex Hsain from North Carolina State University. Together, authors address policy issues at the state and federal level around healthcare, education, public health, gender equality, and the economy. So let's talk a little bit about each publication. In relation to Gabrielle's publication, scientists play an important role in utilizing their expertise to inform and shape public policy and address broad societal problems. The memo published in JSPG by Gabrielle, Lowering Preventable Maternal Deaths in Rural Georgia, highlights the severity of maternal mortality rates in the US, and especially in Georgia, affecting women in rural areas who have reduced access to life-saving healthcare. So Gabrielle, can you tell us a little bit about why this is such a large issue for the state of Georgia specifically, and how your memo seeks to address this problem?
Sure. So maternal mortality briefly just refers to the death of a woman who was pregnant or within 1 year of the end of pregnancy. And so while you might think that in a developed nation like the US, this is an issue of the past, the rate of maternal mortality is actually increasing in the US, with Georgia having one of the highest rates in the nation. And we also found that in rural counties, the maternal mortality rate was 50% higher in rural counties. And so Georgia's Maternal Mortality Review Committee found that many of these deaths were preventable, and that lack of access to care was a major contributing factor. So we tried to set out a way to figure out how we can address this issue. Now, certified nurse midwives are already trained to deal with labor, delivery, routine care, and they can manage low-risk pregnancies. But in Georgia, there are restrictive laws that require an agreement between a number of certified nurse midwives and physicians, and it restricts their scope of practice. So in our proposal, we propose that Georgia expand the scope of practice of certified nurse midwives to allow for more independent practice. That way, they can practice to a fuller extent and thereby increase the access to care for rural and Georgian statewide.
That's really important. Thank you. So I'm curious, do you think this solutions that you propose are things that other states could adopt as well?
Actually, yeah, they are proposals that other states are already currently doing. So whether it's red or blue states, such as New York, Vermont, Idaho, Colorado, Utah, Iowa, all of these states already allow for independent practice for certified nurse midwives. So it's absolutely something that Georgia and other states could adopt.
Great. So it sounds like it could be a statewide policy, but also would be worthwhile considering at the national level what this looks like more broadly. Great, thank you. So we'll move on to Kyla. So Kyla's publication is entitled Decriminalize Drug Checking Technologies in Pennsylvania to Prevent Overdose Deaths. In relation to this publication, it is critically important that we develop evidence-based policy solutions to societal issues that are critical to our nation's success in healthcare, innovation, and economic prosperity. This publication highlights fentanyl test strips as a potential way to address drug overdoses involving opioids, mitigating negative effects of public health and the local economy. Kyla, can you explain a little bit more how we might mitigate some of the effects that you propose through the solutions in your memo?
Sure. So a major driver of overdoses, as well as other adverse outcomes of drug use, is that the illicit drug supply is really unpredictable. So drugs can be contaminated with other substances, adulterated with other drugs, or just misrepresented entirely. And the best understood example is that of fentanyl, which I think we all kind of know what's up with that. It's involved in a ton of drug overdose deaths, but it's not just about fentanyl. New synthetic opioids are always coming on the scene. And beyond opioids, other drugs like MDMA and LSD are often misrepresented. And even caffeine can be fatal if it's combined with the wrong drug. It's just in an unregulated illicit supply, adulteration and misrepresentation are just inevitable. And one way that people can learn more about the drug they're intending to use is by checking it with drug checking technologies. And there are many different types. Again, the best known is fentanyl test strips, which you mentioned. But there are also reagent test kits that can test for a wide variety of contaminants and adulterants. And there's probably going to be testing tools made for adulterants that will come on the scene in the future that we don't even know about yet. And these tools allow people to learn more about the drug they want to use and maybe take precautions to make themselves safer, like using more slowly or using a smaller dose or not using it at all. They're really useful tools. But a big issue in Pennsylvania is that they're illegal because the definition of drug paraphernalia is really broad. And so some states have added exemptions for fentanyl test strips, and other states have amended the definition entirely so that all drug checking tech is decriminalized. And so we're arguing this, the latter amendment, that would be the most effective because there are adulterants other than fentanyl, and new adulterants are inevitable. So we should just go ahead and decriminalize all drug checking tech so people who use drugs can make better informed decisions about their use.
Very helpful introduction, thank you. This is like a very complex topic, so I'm curious, does it affect specific populations more than others? And what kind of regulations currently exist about this issue?
Yeah, definitely. I think the opioid crisis and the overdose crisis are commonly thought of as primarily affecting white communities because that's where it started. But at this point, Black, Brown, and Indigenous communities see the highest rate of fatal and non-fatal overdoses. And that's the same for pretty much any consequence of the war on drugs. It's always going to affect these populations more than others. So if we can get drug checking tech decriminalized, it's really important that it gets into the hands of those communities. So I really hope that's what'll happen.
Great, that makes a lot of sense. Thank you. So move on to Alex. So in terms of Alex's publication, we can think more about the gap between science and society and how within this framework falls the importance of maintaining and diversifying the STEM talent pipeline in order to allow for the best and brightest to utilize their talents to benefit society. This includes women in STEM, who are often disadvantaged in their career advancement due to additional barriers. And the memo published by Alex in JSPG is entitled Paid Family Leave to Strengthen the STEM Workforce, and it addresses these issues that are significant, leading to attrition for women in STEM in programs as well as careers due to parenthood and the lack of US federal mandates for potential parental family leave. So I think this is an issue that has been around for a long time in the educational system, the lack of access and diversity in a lot of levels within academia. And it seems, I think, even more problematic now when we're focusing more on diversity and the systemic issues are becoming more apparent. So I'm curious if you can tell us a little more about how you went about addressing this issue in your memo and what you think potential solutions might be.
Great, thanks for the question. Yeah, you mentioned the metaphor of this leaky pipeline, or the STEM talent pipeline, and it's been around since the 1970s actually. And since then, there has been a lot done to address it from both the U.S. and international community. And actually, there was a study published recently looking at the gap between bachelor's and PhD. And actually the rate for women entering a PhD is becoming more equivalent to men. after their bachelor's. In our memo, we're specifically focusing on this aspect of the pipeline that is further down, right? That sometimes we don't consider enough. We consider high school to college and college to PhD, but we don't really consider how do women actually attain career advancement later on and actually become leaders and representatives of their scientific communities. And so what we were specifically looking at was parenthood, and parenthood as a barrier for women entering into these mid-careers. And because, you know, geriatric pregnancy is considered any pregnancy after the age of 35. And this is typically the time where you see promotions into leadership positions, and maybe even consideration of tenure happens at this age. So there's this you know, kind of tension between deciding between family and your career. And so this has been shown to be a significant barrier for women's participation in the STEM workforce. There was a study published recently that showed that 40% of women actually leave the workforce, the STEM workforce, or demote to part-time work after becoming a parent, whereas only 23% of fathers sacrifice the same amount. So one way that we think is an effective way to mitigate this issue is through paid parental leave, which in some states where it has been implemented before has shown that you can decrease attrition by 50%. And this is due to both economic and psychological incentives for the mother so that she can actually stay in the STEM workforce.
Great, that's really important, thank you. So I want to come back to this issue that several of you brought up in terms of women being affected specifically by some of these issues, as well as different populations, like Kyla mentioned. So how do you think we can mitigate some of these things in relation to specific populations, such either women or underrepresented minorities? Are they more affected? Can we make this more equitable across the US or statewide in your specific issues? If one of you wants to comment on that.
Yeah, I think on the topic of paid parental leave, you know, we see Black, Brown, and Hispanic communities being disproportionately affected due to the lack of paid parental leave. Actually, there was a study that found that, you know, where 47% of white women have access, you know, a much smaller percentage of these marginalized communities have access to paid parental leave. So I think instituting something like these policies would actually improve the outcomes for both the mothers and the infant, because the first 6 months and really the year of motherhood is so important to the cognitive development of a child, as well as that for the mother, for bonding to the infant. So I really think that this policy would help these communities.
Yeah, and to add on to that, I think it's important to be creative in the type of policies that you're trying to implement or propose so that they can have broad effects, but also help these communities. So in maternal mortality, we didn't address in our issue. In our memo, we focus on rural counties, right? But it is also apparent that Black women are 3 times more likely to have maternal mortality cases than white women in America and in Georgia as well. And so even though we didn't touch on that directly, our policy memo was to expand the scope of practice for nurse midwives, but that's statewide. It wouldn't be just in rural counties, it would be in all of the counties. So inadvertently, we would also be expanding access to care for these underrepresented communities as well. And so you can be very thoughtful in how you approach the issue so that it helps both of those communities. And maybe if you're in an area that's a little bit more conservative or may not readily take up these issues that affect underrepresented communities, you can still find ways to benefit them.
Yeah, so it seems like there's different levels here that we can think about, rural versus larger cities, and statewide versus national. And I'm curious in terms of Kyla's memo, so how does, because I think your topic touches on a lot of different groups and can be widely applicable. So what is your opinion about regulating this in a way that is also equitable?
Yeah, like I mentioned, I think it'll be really important to get these drug checking tools into the right hands. I think sometimes when we have these new harm reduction tools that we want to make more accessible, we don't always get them into the right hands. You know, we have naloxone, which reverses overdoses and is an incredibly important tool. A lot of it gets given to police officers and then they don't use it. So that's not very helpful. Or like we have, if these tools are going to be distributed by public health agencies, it's important that they're based in the communities that really, really need it. You know, so I think the distribution will be really key, which isn't something that we touch on in our memo. Our memo is just baseline, let's decriminalize it so that it can even be a little more accessible. But after that, you would really need to think about the distribution very, very carefully to make sure it's effective.
That makes sense. And since we have a broad range of issues here, but also common problems, I'm wondering if you think about who are the stakeholders that can make an impact in the issues that you're talking about. Is it local government? Is it how do you propose that this is addressed? Is it financially? Is it a bill? What is what would be the best way to address it? Maybe.
Yeah, so in our case, this is a federal issue and we're asking for a federal mandate, but there are ways that we can target our legislative representatives. So we specifically addressed our memo to the subcommittee on worker and family support within the Committee on Ways and Means in the House of Representatives. So I think even reaching out to my representatives and educating them about this issue and that I as a constituent care about it, I think could be a very effective way to see this being accomplished.
Yeah, I also agree that even though something might be more broad, so our memo was looking at the state of Georgia, looking at your local government to implement these changes might be the most effective because you have a lot more pull and say as a constituent of any given town or state than you would then maybe at the federal level. And a lot of times laws and policies will be implemented on a state level and then it expands and then becomes federal policy. So for ours, we are addressing the Georgia State Senate, specifically the Health and Human Services Committee. So there is likely for any policy issue, a specific committee or organization in your state or whatever level you're trying to address that will specifically look at the issues that you're concerned with. So you can talk to those people directly and it's likely to have a better outcome.
Yeah, we also brought our memo to, we originally targeted it at the Judiciary Committee, but with the election, things got moved around a little bit. And we brought it to our representatives. They were really excited about it, which kind of makes sense because we're in Philly and Philly's been hit really hard by the overdose crisis. So it would make sense that this sort of thing would be addressed at a state level. We issue that bill, we strike these clauses from the definition, and then local groups can take action. And I can imagine that Philly would lead the charge on that. Philly and Pittsburgh most likely, because they've been hit so hard and have a lot of harm reduction groups on the ground and ready to help.
Great. Yeah, I think that's very insightful to think about the level where this action might be taken and who might be doing that, because it could be done at different levels. And I think one question, also for our viewers who are obviously early career and thinking about how to design a good policy that would address some of these issues, what advice do you have for them to think about policy development as well as utilizing the skills that they have to transition into policy to address some of the things that you're working on?
I think my advice would be to be creative about the policy solutions you think about. It doesn't have to be a legislative action. It could be, an executive order or some sort of treaty or a memorandum of understanding. I think you can be very creative. In terms of research, you can think about doing a request for proposal or instituting a center for some sort of development that you're seeking. So yeah, just think outside of the box. You don't have to be constrained with any specific legislative solution, and yeah, in terms of that, just consider the costs and benefits of anything that you're proposing. Be mindful of who you're speaking with, what side of the aisle do they reside on, and what's important to them.
Great. And just to add another layer to that, how do you see some of these policies being implemented? So what's sort of the next step after, the memo's out? So what are your next steps you're thinking of?
Well, like I talked about a little bit, we had a lobby day and brought our memos to legislators, and a number were really interested in sponsoring a bill. So we're going to have to check back in the new year with the election being over and everything. But I feel pretty optimistic that it'll hopefully be a reality, but we'll see.
Yes, our group is also looking to actually get this to the Health and Human Services Committee. As you all are probably aware, Georgia is getting ready for a runoff Senate election, which is going to be unprecedented. So it may be a little bit of time before we'll be able to get their full attention on this issue, but we do plan on pursuing this and actually, maybe seeing if this policy could be implemented.
Yeah, I think for our paid family leave policy, we're going to try to join up with some groups that are already working in the space, specifically through the university, because I really think there is strength through numbers, and maybe doing a joint advocacy day on the Hill sometime in the spring, either virtually or in person. We'll see where we are. But yeah, we're definitely really passionate about this topic. We think it's very important, and we definitely want to communicate with our legislators on this.
Yeah, thank you. Those are really great solutions and advice, I think, as we also think about future authors who want to publish in the journal and what they might want to do afterwards. We always like to ask that and think about how these policies and ideas might be implemented more broadly. So just lastly then, do you have any last minute advice for early career researchers who are interested in doing science policy or publishing in JSPG? What sorts of things should they think about as they're entering this field?
So one thing that I would say is to not be intimidated or afraid. It can be difficult because policy and legislation is not necessarily in our general scope, right, as scientists. But a lot of the skills that we learned, critical thinking, deep literature review, creative problem solving that we use for our science, you can actually use to tackle these big policy issues. So, just because you're not formally trained in this sort of thing doesn't mean that your skills aren't going to be incredibly helpful and valuable in pursuing that.
I'd also add that for any given issue, there's almost definitely going to be people who have spent years thinking about it, and you're almost never going to be the first person who's trying to solve a given problem. So to design good policies, it's really important to listen to the people who have been in this field for decades. But also even more important than that is to find ways to listen to the people who are actually affected by these policies, because they're the ones who are the true experts in what would help their communities. Like in our case, people who use drugs really want drug checking tech because they care about their health and they want to know what's in their supply. And so ultimately that's what should guide your policy recommendation, not just what's achievable or politically feasible, but what the people actually want and what they need.
Mm-hmm. That's very helpful. Alex?
Yeah, and from me, I would say don't be afraid to cold contact people and reach out in the science policy community. I think anyone is going to be happy to talk to you about a policy topic that you're writing about, or just general career advice. We love talking and we love communicating, so definitely don't be afraid to reach out to people and broaden your network, because you never know when that could be helpful and where that's going to land you next.
Great. And with that, we can wrap up today. So thank you, Gabrielle, Alex, and Kyla for being here. Thanks everybody for joining us. You can find this episode and others like it on JSPG's YouTube channel and on SoundCloud. And that's it for this week's episode of SciPol SoundBites, the podcast of Journal of Science Policy and Governance. Thank you. If you enjoyed this episode, subscribe to our podcast on YouTube and SoundCloud. You can also follow us on Twitter, Facebook, and Instagram at SciPol Journal.